Surgical intervention is high in the United States for spines. Surgical intervention is, there's 1.36 million surgeries in 2021. There's 1.5 and 1.2 in 2023 and 2024. It's like the stock market, way better for surgeons though, okay? So we know that surgical intervention for the spine is happening a lot, and it's getting more and more all the time. Every single spine surgery costs between $50,000 and $100,000, some of them way more. Spine surgeries are important to be able to have, but you need to know the risks. Every spine surgery that's performed, there's a 19 to 24% chance of a follow-up second spine surgery. And so when you take those data points into consideration, what happens is they have syndromes and diagnosis built around spinal surgeries. There's syndromes called adjacent syndrome. So the next segment starts to wear out if you fused another couple segments. And so they end up having that next segment fused. Same thing happened to Linda. Her x-ray here, do you see this wedge that's forming? Remember when I pushed on her rib? So you have the square vertebra here, the disc above it and disc below it. You can see this vertebra, because how far she's backwards and how far she's leaning forwards, puts all the pressure on that bone. Now it's collapsing just like a cinder block, just falling apart, sand falling off of it. So that adjacent syndrome is real. So you get your back surgery, you need to take care of it, but also try every single thing you can before back surgery. Medication, injections, physical therapy, chiropractic, acupuncture. A lot of the things, like even Sam was talking about breathing techniques, you downregulate a sympathetic nervous system, a fight or flight, you can downregulate pain for a person, improve healing, improve oxygenation, tons of things. Add yoga into your life. Add this MAP stuff that we're talking about today. So the MAP stuff is super important because it can take you from where you're at and improve it over time. So chiropractic care is also in with your PT. Be able to utilize your chiropractor. There's tons of different styles of chiropractic, tons of different styles of physical therapy, and we'll talk about those types of care options here. So we talk about pain relief. We talk about rehabilitation, like exercise. We talk about decompression. We talk about, like Kevin, structural change. You can actually bend and change the structure of the spine, take the pressure off the nerves. Sometimes it's too far gone and you need to do the surgery, but you need to go through this algorithm first. So this is pain relief care. In our office, we have lasers. So a laser is, like class 4 laser, is extremely hot. And we can penetrate through the skin, the muscle, the ligaments, and we can go into the disc and run a laser into the disc and actually heat the disc up and get it to start regenerating and calm down inflammation in a disc using a laser. If you have a tattoo on your skin, the tattoo goes away too. We actually can't do it over tattoos because it actually burns the tissue. So we have to do it in areas that we can. Next one is going to be manual therapies. Anybody ever shot a shoulder or a knee problem? So rotator cuff. So a rotator cuff injury, strain on the ligament, on the muscle, and it gets partially torn. We can do manual therapies and scrape that tissue and regenerate the little fibroblasts, little cells that lay down new tissue again and get your body to heal itself. So the other thing when we start doing this, I mean, when we do the manual therapy, you can also do injections. We don't do those in our office. You can get stem cell injections. Super cool, sexy new thing to be able to do. Go get PRP, stem cells, and you can actually get new cells that are not programmed to do anything other than heal or whatever tissue it's around to be able to program to what it's there. So you take an injection and it lays down new rotator cuff tissue, new cartilage, those types of things. The technology is out there. Getting adjusted, getting those single segments to start moving. When we bend over and stretch, we're stretching the whole region. An adjustment gets in and adjusts specific segments and gets them to move and relieves pain and discomfort for people, improves mobility on those stuck segments. This is overlooked in chiropractic offices, and in PT, they're starting to do adjustments and manipulations at physical therapy, which is super cool, and you can go as a PT and learn it in a weekend. We just spend 4 years doing it. So rehabilitation is exercises that strengthens around a dysfunctional joint. It can get people posturally upright, but it can't change the structure of the spine very much. Within about 5 degrees of curve, you can improve the curve with exercises. Rehab is super important. Shoulders, knees, back. We were talking about MRIs yesterday. So when we take a steak, we want marbling in our steak, right? It tastes better. Good fat in it. If you get an MRI, some of the new research that's out talks about the MRI of your low back, and they do cross sections of it. And if you see marbling within the muscle, it's atrophied, it's shut off. And with chronic pain, you see tons of marbling because it shuts the muscles off and they turn into fat. Rehab and exercise is highly important. Decompression, super cool new technology, okay? Super awesome. So this table can take and separate itself. So it's whether it's a neck or a low back. It can take and change the angle based on where the spine is curved, and it can pull and pump that tissue. So if you have a disc herniation, it sucks that disc herniation back up inside the disc and lets your body repair over that tissue to make it heal. If you have tons of arthritis, it can take, there's different protocols we use, but it'll take and pull tension and pump fluid back into a dried out arthritic disc, and you can actually see some of the disc fatten back up and or prevent it from getting worse. This guy had a disc herniation, came to my office. Oh, that's me. About 2018 or 19, I ended up hurting my back. I have had 20 years of, that's how I got into chiropractic. I was like, oh, this stuff is awesome. I'm a diesel mechanic. I see the mechanical side of this. You can fix things in the body. And so that's why I got into chiropractic. So this disc herniation's been around a long time, and I do stupid things and go lift. I used to power lift. I used to do just things that would push it too hard. And so anyway, I was bent over lifting. My back hurt, like I hurt it. The disc, it got irritated, collapsed, fell on the weights, and just was like, all right, this is big time. And so later down the road, I started working out at CrossFit. This was 15 years later. And so I'm doing squats, and my knee's tipping in, and I didn't realize it, but the trainer was like, hey, this is going on. I'm like, oh, this is my warning sign, Oklahoma. And I know what's going on. Then my back the next week is just on fire. All right, I can always get it under control with chiropractic. I didn't realize that this stuff was as cool as it is. So when you start getting on decompression and pulling on it, it can help. But I got lost in it, and I was like, all right, this herniation's huge. It's 8 millimeters out the back, and it droops down, and I've got a bad problem. So my herniation in 2018-19, I'm supposed to ride this mountain bike race in like 4 or 5 months, and 4 months. And so I'm like, I can't even ride my race. Like, this is not good. And so I'm like, Dr. Gaffney, I need to come in, get checked. I got something going on. Get my MRI. This is what's going on. And he's like, Bob, we can do surgery, no problem. It's pretty fast. You're pretty functional within a week or so. I'm like, okay. He goes, what else have you tried? I'm like, well, I know this is bad. I'm starting to feel it down on my calf, down on my foot, side of my foot's going numb. I know that it's bad enough that, and I don't have a lot of time to be able to do this. He's like, you need to believe in what you do a little bit more. Another Linda situation. I'm like, holy crap. So he puts me back to work and says, go do your thing. So I'm like, all right, we do the blood work. We poke my finger, squeeze it out, test my inflammation. We talk about fish oils and omegas. So we have omega-3, which is the good ones, and omega-6, which is our bad ones. We tested a few of the firefighters and myself, the 200 firefighters, and there's only 5 firefighters that passed. I am in this situation, and I'm like, all right, I've tested it before, and it showed inflamed, but I've been taking 5 fish oil a day for like 5 years. And it's still bad. I'm like, I don't believe this thing. But I'm like, I'm going to do what I tell myself. So I up my levels of taking my fish oil to 10 a day. So don't think of it as I'm taking medicine. It's taking a food in because it's an oil. It's a fish product. So you're taking this higher dose of it. So I take in 3 months and I get my omegas from this high omega-6 inflamed. So what that means is you pull your red blood cells out, smash them, grind it up, and then they take the fats out of all the cell membranes, and they put the 6s over here, and they put the 3s over here, and they put them in counts and then ratios. So I showed up that I had omega-3s, but I didn't have enough in my ratio. So I ran my intake of it up. In that 3 months, I was able to get my 3s back to normal. And by that time, doing all the work that I was doing, both nutritionally and then also movement, and then decompression and acupuncture, those types of things, I was able to take my back from there on the left, that disc herniation. So this is that bulge. So this is the sacrum. This is the L5 disc that's pooching out right here. You can see it hitting the nerve, like it's pushing the nerve out of the way. And then you go up, this one's normal, that's a juicy disc. You can see the white part in here. Bone, disc, bone, disc, bone, disc. They're all pretty good. This one down here, not juicy. It's a pretty dark line through here. So I also had a short leg, and I had worn a lift, but I retook my x-rays, and I had to square it up even more, so take it up to 8 millimeters to be able to get my pelvis level, so it's not wearing on that disc on a crooked foundation. So you just have to stay on top of it, because things change over time. So I did all this. Now my disc herniation is gone. You can see the nerve is now healthy and not getting irritated. But if I go be stupid and I lift something crazy heavy, my calf starts aching. My back doesn't hurt. It's just the nerve that's irritated. So I can flare it up if I want to. It's there, okay? But it's way healthier, and I was able to ride that Dakota 5.0 mountain bike race, 50-mile mountain bike race, 4 months later. So I know it's possible. It shifted me at the core. I know people can do it, and I've taken hundreds of patients through it. Other approach is wellness and prevention. So Jan, 76 years old, she works still 5 days a week, all through the year, holidays or around holidays and gift time. She's working 6 and 7 days a week. She loves her job. She walks 3 miles a day, does her nutrition, and she gets work done. And anytime so she's stayed at a routine of like every 2 weeks getting adjusted. No migraines. She feels good. She doesn't wait till she has a problem. At the gold mine, when we worked with them, their mobility in their middle back. So when we test that, you guys are going to lean over a foam roller and you're going to see if you can touch your bottom and your head to the floor. So you're going to see if you have loss of mobility. They had 54% loss in their entire operation as an average, and their age was only 40 years old for average. So we know that they've got a big problem. Over the next 3 years, they worked on their mobility, they improved it by 50%, and they all felt better. They all reduced their injury rates, 90% in fact. Fire department, all 200 firefighters, 5 tested okay on their omegas, on their nutrition, as far as the inflammation. Their 6s were really bad for the entire fire department. So when we took this blood test, we took it and we started to talk about, you need to take your fish oil, you need to take your fish oil, you need to take your fish oil. Pretty soon the fire department's like, Dr. Bob and his fish oil fire, guns just blazing, right? They're just like, ugh. So you have the older firefighters and you have the younger firefighters. Some of the younger firefighters are like, I'm gonna listen. A lot of them didn't. Middle age, nope, not too much. The older guys, okay? The older guys started doing it because they're like, man, my hips, my knees, my feet, everything's sore. So they're motivated because of pain. They started taking it, and the group's numbers started getting better and better and better. And all of a sudden, you saw this cool family thing happen. The old guys were turning around and saying, pay attention to your posture. Pay attention to your omegas. So they all started taking their omegas, and we had a huge shift in the department. When you start taking your right amounts of omegas, you end up improving that inflammation. It doesn't just help you in your musculoskeletal, how you feel. It helps you in cardiovascular risks, cancer risks, tons of other areas. So I came in saying everybody's got to do 10 fish oils a day. 6, 10. What I found out after hundreds of the firefighters is it only took 2 or 3 for the majority of them to be able to do it. Some people don't absorb omegas the way that they should or process them the way they should. So that's why I had to take my high dose amount, and it's what shifted me. So I got mine, they started getting theirs, and the whole department felt better. So that's a good question. So yes, you can have too much because it can cause thinning of your blood, okay? And so start off, and find out what your blood test shows too. Just like vitamin D, are we all deficient? Almost everybody is deficient in vitamin D. That's another risk of cancer. Fire department as a whole was really low. So you can take too much. And I had a patient that felt so dang good. She's like, I'm gonna take 50,000 IUs of vitamin D a day for the rest of my life. She was like 200 and some. When you take too much of like vitamin D, it hardens your arteries, but you feel better. Even your testosterone, your hormones change when you take right amount of vitamin D. So you have to take certain amounts. So normally I start people around 5,000 IUs, and that's a good maintenance dose amount. Omegas, same deal. Start off, know where you're at. That's like the best thing. So if we tested the whole group, great. If you do it as an individual, great. But if you start off at 2 or 3 or 5, it's a good number. If you're on blood thinners, and you've had heart problems in the past and you're on blood thinners, you have to really watch it because it'll be too much and you'll bruise and bleed and cause problems. So yes, you can take too much. We're going to talk about mobility today. This is the card. This is your steps to follow. It's really important to use this thing, and you'll take this thing and put it wherever you have your spot to roll out, do mobility, and you'll use this thing all the time. It's so important that on the Facebook page, it's on there. And if you guys, this is that moment with your phones, QR code it, hop on there, request. It's a private group for you guys. And you guys, it's your groups where you get this information. So you do it if you want. So we're gonna roll out. We're gonna use foam rollers, lacrosse balls on our hips, on our sides of our legs, on our feet. We're gonna use all of those. And so that's what we're gonna do. So everybody's gonna hop up, and we're gonna go do that right now.